we're going to do our eye test. Let's get the glasses out. So this is the first one. It's called Big H. So you can look at me or you can look at the camera. So 2 fingers in front of you. And all you need to do, just follow your both eye. Do not move your head and follow your 1 finger. And you're gonna draw an H, like on the side, up, down, and come back. I'm gonna help in the beginning. So, up, very slowly, and down. Follow with your eyes. A little bit right in here. Don't move your head. Here we go. Come back, and come back here. Switch fingers. Yeah, switch. Here we go. And just tell me which one is easier to go.
Right.
Right. Here we go. Because you see, we got the eye surgery, and now it's all affect the walking, the leg. So and keep going, like drawing. Very easy, low. Yeah. And this is great exercise because you see your brain is thinking to start turning that eye. Here we go. And you more the practice, the more smoother it's gonna be, and that's gonna create that stability in your body and secure your walk. Next one, I want you to do. So we're going to do our left eye. So you're gonna get this to the 45 degrees like this, and start, just look at that. Do not turn your head, but look at with your eye. And this arm coming up here, and you just doing this rotation, whatever, like this. No, relax, and you just like, no, like this, like very slowly, the whole wrist, like whole arm, like moving. There we go. You keep looking up there with your eye. I know this is one of those crazy stuff. Now watch. You can do this. You can do 1 finger, 2, 3, 4, 5. Open up. 1, 2, 3, 4, 5. Keep looking up there. So what's happening here? Action is here. So she start. It's kind of distract her, and she start watching here. 1 finger. 1. Another one. Slowly. On the top. Open up, and you see. And here we go. You see? Now try, keep looking at it. Try to relax your face muscles. This is the key, yeah. This is one of the tests. Now another one, you can close your eye. I usually close with some, let's say, card. Go ahead, let it go. Now you can hold this or close your eyes, whatever, and work with this arm. Let me just guide you. I usually grab something like colorful, like yellow or orange, and I just like touch it. No, and let it go. Touch it. Watch with this eye and touch it. You see that eye? It's hard to go to up. What about left? And just now look at that one. So I go close, away. She can also, what you guys can do, move your tongue. This is going to be the next one. How's it feel? You're doing okay? Can you see it? I'm not going too fast? Great. So this it's visual, neurological. You can also put some, like a noise to your ear. It's another release. Next one we're going to go do together. This is going to be the most weird one. Let it go. You ready for the weird one? I'm gonna do it with you. You're gonna grab that. You ready? So watch. Let's do first one. It's also our tongue position and can affect everything. Atlas, occipital area. Remember your chiropractor, adjust your atlas. So guys, always ask the chiropractor adjust your OA joint. It's very important because it can be regulate your walk. You feel better after you adjust it. You walk better. Here we go. So. Next one, it's also related to our neurological. So what we're going to do, we're going to move the tongue like this.
Like cleaning your teeth?
Yeah, like cleaning your teeth. And you can go all different rounds, like 3 times one way. And while watch, stick your tongue out. And poking. And close your mouth. Now try to walk. I gotta throw this away. Try to walk. See how you feel. Try to turn around. See how you feel. Weird? I know. So this is how it is. Our brain this is to control all those motions, and sometimes it's stuck not in our joints, it's stuck in not on our muscles, it's stuck in our head or in our vision. So that's why we're cleaning this out. How you feel?
Good.
Excellent.